on him and know what's happening to him.
Okay, Doctor.
Okay, Mom. Your child's result now come and he got diabetes. They want to call sugar sickness.
What?
Yeah.
How that won't happen? How small boy and man so will be having big people saying that?
Mom.
Yeah.
Sugar sickness not only for big people. Yo, small children can catch it too.
But how small children can catch sugar sickness?
Sugar sickness can run in the family. When the woman get belly and she get a sugar sickness, her child that she born from the belly may get a sugar sickness in the future. Yeah. Besides that, even when the woman gets sugar sickness when she was having the belly, the child will still get sugar sickness from other things like not eating food that will make them healthy. When the child is too fat and it got serious infection when they were born.
Doctor?
Yeah, ma'am.
What do you want to do now to keep my child healthy?
Make sure that the child takes his medicine on time and the child should play and eat good food.
What kind of food again, Doctor?
Food like orange, banana, guava, apple, pawpaw, watermelon, plum, grape, and butter pear.
So, Doctor, that all?
No. The child should also eat green.
A very, very pleasant good morning. Welcome to another informative and educative edition of Roadway to Health, an hour-long program brought to you by the Ministry of Health, of course, designed to educate, inform, and empower Liberians about health-related matters, giving you the tools to make informed decisions about your health. Today is Tuesday, September 16, 2025, and driving you through this edition of the program are Angeline Noah and
Melvin Stewart.
And of course, we have Augustine Gaima here, making sure that you get access to this program through the Ministry's official Facebook page. We also have the Director of Communications and Health Promotion Unit here with us, working behind the scenes to make sure that you get access to this program as well. That is Augustus S. Walker, So wherever you are joining us from, however you are joining us this morning, we'd like to say welcome. It's always a pleasure to be here with you. For those of you joining through the Ministry's official Facebook page, we'd like to encourage you to like and share the live screen. And to our dedicated radio listeners, we'd like to say increase the volume of your radio, invite a friend or relative to listen along with you. We'd like to take a special moment to send special greetings to the Minister of Health, Dr. Louis Porto, our able deputies, assistant ministers, and other staff at the Ministry of Health. We want to say thanks in a special way for your continual commitment to shaping the health agenda of our country. Well, this morning we have invited in studio JFK again, represented by Dr. Woody Frank A. Benson Sr., consultant pediatric surgeon at JFK. Dr. Benson is said this morning to provide details on the pediatric surgical services being provided at JFK, and other details about that services will follow as we deepen our discussion on this program. We'll take a very short break to be back with details. Welcome back and thanks for rejoining us. We now join our guest in studio. Good morning, Dr. Benson.
Very pleasant morning to you too.
Okay, how are you doing? Welcome to Roadway to Health.
Thank you so much. I'm glad to be here.
How is JFK, specifically the pediatric surgical unit? How is it?
Well, it's okay. JFK is fine. We have an able team being headed by Dr. Linda Bush and Dr. Tamba, who's our chief medical officer. And so we're there. The pediatric surgical unit is also there. And we're part of a holistic department that is called the surgical department. So we are trying one day at a time.
Okay, so you are a pediatric surgeon. Tell us who a pediatric surgeon is and why did you choose that field?
Thank you so much for your question. A pediatric surgeon, number one, is a doctor who first must have graduated from a medical school, and then after I did my training at the in Liberia at the AM Dokley College of Medicine, and then after that you go ahead and specialize in surgery, specifically pediatric surgery. So the pediatric surgeon is one who trains specifically to address the surgical needs of children from day zero to adolescence, and that is those who require operation, simply put.
Okay, so why did you choose that field? Is it passion driven or why?
It was both passion driven and but also seeing the need. Before I went to specialize in pediatric surgery, most of the surgical interventions for children were being carried out only by our general surgeons. And so there was a big need for us to address the needs of children requiring surgical services. So I thought that my love for children in general and my attraction to pediatrics in general attracted me to the field, and for the fact that I like surgery, I think it came naturally.
Okay. So we keep repeating the word pediatric and surgery, but I mean not everybody agrees with that. So tell us, what exactly do we mean when we say pediatric surgery?
Yeah, so thank you. Pediatric is just the group of individuals that fall from the first day of life. So from day one of life up to 16 years old. In JFK, we say up to 14 years old. But those who are under the age of 14, 15, so from day zero. So once you fall within that group, you're falling within the group of what we call the pediatric, so from day zero to adolescence. And then surgery refer to those who need to be operated. Like if you have a problem and you need to be operated, simply put, they say you need to be worked on. Okay, so those who need to be worked on, those are the people who we will fall in the group of surgical diseases. Yes.
So, looking at your specialty, you say you, for the love of children, that's why you went into this professional field. And is it only children that you cater to, or you cater to? Sometimes you pop in, I mean, to do some surgical works on adults.
Well, I do adults as well, but specifically right now, because even before you get to doing pediatric surgery, you have to go through general surgery. So I do adults as well, but now my focus, my specialization is on kids and children. Yes.
Let's look at the word pediatric. When we talk about pediatric, I know you've spoken it, but you haven't explained in depth in a layman term. Somebody in the village, they won't understand the level of English you're speaking. So if you just break it down a bit for the mothers on the farm, and so that they listen and know what actually they need to look after whenever these conditions are being attached to their kids.
Yeah, thank you. So pediatrics, if you go in the hospital and you have a child today and you born a baby, the baby is 1 day old, falls under the group of, the general group that we call pediatrics. So pediatrics are just children, all right? Your children who are underage, who you're still taking care of. So even if you're day 1 old, from that day the baby come outside till the baby is 14, 15 years old, that baby has, is falling in that group of children generally. So pediatric just refers to children in general.
Oh, okay. So, Dr. Bensi, what are some of the surgical conditions that affects, children, the babies that you're talking about?
Yeah, thank you. So since I came to Liberia, the burden of pediatric surgical diseases, like some of the diseases that we see, they may range from hernias, for example, to appendicitis, for example, to children who have to be operated for they're born. Some kids are born with an anus, they can poop. So from day 1 of life, you born a child not pooping, some children, some boys, children, they're delivered, and you see some of them, their testes have not descended fully. It's still up there. People say, oh, the tina can't die here. You know, some children who got knot in their body, knot on their stomach, then their navel big, all those kind of things. Those are the kind of diseases that we've been addressing ourselves to since our coming.
Why is it so much important for pediatric in the life of a child?
That's a very good question. I think one of the first things that we need to understand is I usually say most of my patients will outlive me. So most of the children that you operate today will outlive you, meaning that once you identify a child to be operated early and that child is sorted out early, the chances of that child living a good and full life is better. So, you know, there's a thin line between surgical intervention and survival, and that highlights the long-term benefit of these children who get timely surgeries, because if the surgeries for them are not done in time, it affects their growth, it affects their development, it affects the general outlook of that child. Imagine a child who has been born, maybe for example, his testing can't die. If he go play among his friends, you know how his friend will start looking at him, you know, those kinds of things. So generally, those are the kind of things that if those children are operated early, their livelihood, their lives become better and they can live a full life. Yeah.
Okay. You mentioned the hernia, which is one of the conditions that you've been working on, and then the blocked anus. I mean, what causes the blocked anus and that of the hernia?
Okay, so I'd like for us to take some time on these conditions, like somebody who has been delivered without an anus. So nature has a way. If you look at children during development, both our whole developmental system, the place that pee come from, the place that poo come from, it can be joined together, you know, in the woman womb. With time, it separates. Unfortunately, some of those children, when they are born, those places do not separate. So you look at that place where poo is supposed to come from, a stool supposed to come from, there's no opening there. So when that child is born, the stomach is big, the child is vomiting, the child is not poo-pooing, and within days that child can die. All right. So that's what it falls under the general group of what we call anorectal malformations, children who are born without anuses. And so from day one of life, we see those children, we operate on them, we do operations for them, and it's a process. But most of those children, if you intervene early, those children can survive. Yes.
Okay, so you want to talk a little about the surgical procedure for the blocked anus, because you've done that.
Yeah, so generally what we do, we create now an anus for these children. So with time, we relieve them of the obstruction initially. So we'll generally see those kids, put maybe a colostomy for them, and then it's called posterior sagittal anorectoplasty. But what you're really trying to do is just to separate those two systems from together, and those children are very small, so it's a very complex, highly skilled procedure. But those things are generally done for kids now in Liberia, and I'll hasten to say that most of those surgeries, before people got specialized, before people learned how to operate on children like that, most of those surgeries were not being performed in Liberia. So people would take these kids, there are organizations that come and take these kids and take them to Ghana or take them abroad, you know, and sometimes some of these children will wait for international NGOs to come to Liberia. But now, you know, with the unit that we have and the surgical department that we have at JFK, most of those surgeries can be performed here, and so that you know, that adds to the value of what is being offered from our facility.
And let's look at some of the barriers in tackling these problems, especially in the lives of children?
Well, I like that question. So, number one, the first barrier I think is the myths. All right, the myths surrounding pediatric surgery. One of the first myths surrounding pediatric surgery, I don't know if you have a child, but if you have a nephew, for example, and I, Dr. Benson, just come and tell you your nephew would need operation. Put it in your shoe, you might say to me, this child is too small to be operated. All right. So it's a general myth amongst Liberians, even educated or uneducated, that children are too small to be operated. So that's one of the major barriers in bringing the child to the hospital to seek, advice or to seek, care. So one of the things that we find every day, we will come and make a diagnosis for a child, but then we tell this mom or this dad, your son or your daughter needs a specific operation, and that person may come and say, okay, doc, I will go think about it, and maybe after a few months, you don't see them, they don't come. The second barrier towards, surgical intervention, especially for children, is the idea that because the child is small, the problem is small. All right. So, henceforth, the family do not put as much resource into sorting out that child as others would do. Like, for example, if a child has a hernia, they're like, this child, this is a small problem, so let's wait. Let's wait until the child gets big. The other thing is that most of the time, because of the war, we had a 14-year civil crisis, and because of that, we had a lot of NGOs that came. One of the notable ones is MSF. MSF was in Bartlersville for a while, and they were doing pediatric medicine, pediatric surgery, and everything was free of charge. So nowadays, when patients come to the hospital, the general perception is that pediatric surgery or surgical intervention should be free. So those are most of the barriers that you find. People don't want to bring their children because they feel the child is too small to be operated. Number two, they think the problem is small, so it's a small problem. Number three, they think it should be free of charge. So if they're told a certain price for that surgical intervention, they're like, I'm not supposed to pay, I'm not paying, and they overlook it. And as a result, these children get complications. Since I came to Liberia, I operate a child per day, and when I look at the number of surgeries I've done, they're in the tune between 250 to 300 surgeries, and that's just between January of this year to September of this year. And so there are surgical diseases out there. The problem is people are seeking care at the wrong places. That's one. People are not looking for the best care, and people think that they shouldn't intervene.
Do we have pediatric surgical services, a particular unit at the Ministry of Health that is responsible for these operations?
That's an excellent question. No, we don't. And that question, I really like it, because that ties into one of the things that I would suggest be pushing with my bosses and with our able Minister of Health, that apart from having diseases of infectious diseases that is being run by the pediatricians, we need to have a unit that either incorporates surgical services, especially for children, that we can now put it into policy. A rectal malformation, for example, needs to be operated today. All right. If a child is born, he's not pooping. Imagine, as a human being, you can poop. All right. So your stomach start getting big. The child with appendicitis, for example, child who has pain in the right lower quadrant, and sometimes we seek help at these clinics. We seek help at these drugstores, they go there and people give them all kinds of medications and delay, their coming to the hospital. So as a result, those children are delayed, and when they come, most of the time their appendix is burst. We have pus all in the abdomen. Those children, for example, needs to be operated. Children with hernias. One of the general myths is that a hernia, the big navel thing that children can have, big navel into it. So when the intestine gets in there, it gets trapped. When it gets trapped, it causes pain. If you don't address it, okay, with time, that pain keeps coming, that place, and that bowel gets, obstructed, and it dies, and the children come and they come with many complications. Children who their testes are up there, they need to be operated, because if their testes stays up there for some time, it affects their fertility issues. Some children, one of the general things that we do, one of the things I want to talk about is circumcision. We do circumcisions at JFK for our children, and the reason is that I've seen a lot of children who have come with complications from circumcision. Somebody goes and circumcise them, and they've done it wrongly, or they've chopped off things that they shouldn't chop off, and we have to go and reconstruct. These are things that are easily preventable if you seek care at the right place and at the right time. And those are things that can be intervened. They can say, oh, my C or something, growing not on my side here. So down in their groins, they can have what we call inguinal hernias. Children can have that too. And for adults, there are different kinds of hernias, but most of the time, predominantly, and you'll be surprised, it does happen in girls too. All right. So girls can have hernias.
Early intervention.
Okay, thank you. So appendicitis in children, depending on the age, is generally those babies, those children, especially maybe 9 years old, 10 years of life, because they will come with that pain. They will say the pain is around the nail, then the pain start going, then it go down to the right side. It's hard, and then that child is vomiting, that child is not eating, that child is not passing stool. Those are all symptoms that you'll be concerned about. The child has a fever, all right? Those are all symptoms. The child has pain. The child show you particularly that only the rest side, the pain just here. The child won't eat. The child vomiting. It's not all cases that will be appendicitis, but you better safe than sorry. Bring your child to the hospital. Bring your child to the right facility, and we assess them. And it's better for the health practitioner to tell you this is not the case, than for you to sit with the child and the child comes and after a few days the child is very, very sick. Yeah.
There are people especially in rural parts of Liberia, who blame some of these health complications on witchcraft activities. And what can you say as a professional health worker? What can you say to them as a way of motivating them or encouraging?
I grew up in a church, so I'm a Christian as well. So we pray, but there are always solutions that God offers in different ways. And so witchcraftism, I don't want to allude myself every time to telling people this is not witchcraft. I usually tell you, come to the hospital, come get checked. It's best that you come, we see you, Charajina.
Yeah.
The child can poo-poo, the Charajina. Some children who are born, their whole intestines outside. There was a case of a child that came from Grand Bassa of recent that was called, and because my colleagues know that I'm here and we're here at the Department of Surgery, so someone called me, Dr. Benson, we have a child, the entire intestines, born today. Entire intestines are outside. He came to the hospital, we managed him, and that child is now back in Grand Bassa, is living. So before people will see those children and say, these are witchcraft, these are things, these are medical conditions that can be addressed. So I'd say, if you believe in witchcraft, that's fine, and that's your opinion. Bring the child to the hospital. Let's say we're not able. Then you can go and, and do what you want to do. But most of those cases, I think, can be addressed. And if you find the right healthcare practitioner, and that is important. And I want to commend the LMDC. Shout out to Aeon Cassell and his team there for what they're doing, going out to these people and finding out these quack doctors and things. You know, there was a child who was just delivered at another, in somewhere, was it in Red Light, that they saw the child had a myelomeningocele on the back, and someone went and opened it and said it's an abscess.
Myelomeningocele.
It's just a neurological thing that affects the spinal cord. But the spinal cord was open, all right? And then somebody went and took a knife and put it inside. I mean, the thing that controls the nerves and all the supply to the legs. You know, and that child came to our department, the neurosurgeon, and guys had to intervene. So it's ignorance, but it's also, I admonish parents, we're here to help. You know, bring your child to the hospital. Let's see your child. We'll give you advice, and then we can move on from there.
So I think you mentioned from the beginning that not in the bad, tumor or cell enlargement. I mean, you know the best term for that. And then this same appendicitis and that of the onion. I mean, just one after the other. The causes, especially appendicitis in babies, I'm really concerned.
Well, appendicitis, so when you go back to the medical explanation for what appendicitis is so the appendix is at there's a transition between the small bowels, the small gut, and the big gut. There's something that's right there. It's just a long thing that comes there. Usually it gets blocked, okay? It gets blocked by infections, you know. But what happens is our immune system, see, there's something called lymph nodes that usually helps our bodies to fight infections. At the time between 9 years old to 11 years old, they proliferate. Proliferation means they get plenty, they grow more. And so sometimes that increase in growth can cause obstruction of you know, the appendix. And when it does that, the appendix get inflamed and it bursts, and there are many reasons why a child could have appendicitis, but that's one of the easiest and the most logical explanation, especially why it's more permanent in children of that age. So when you see a child between 7, 9, especially 9 to 12 years old, start complaining about that pain, that thing that is not going away, acutely, it's important to bring that child to the hospital. Now, hernias are usually congenital defects. So you see, most of the testes, all right, the testes, it is developing in the stomach during growth. And when it comes down, that place usually closes, okay? For children, not for adults, but for children. So when that place closes, where it comes down from in your abdomen, nothing's supposed to pass. But in some children, it doesn't close. So as a result, it becomes a defect. It becomes a hole through which your intestines can go into, and it becomes trapped, all right? So those things need to be addressed. Even for adults, when, you know, for the bigger guys, as you grow older, some of the time we even say that in children, if it's not addressed, in adults you go and you start, you know, some of the time they start straining, you know, that particular hole is already open, and you know there's something that aggravates it. You see it gets there. And then older folks, for example, as they grow older, those muscles become a bit weaker, and then, you know, they get hernias in those places. So that's one of the most common diseases that we find. It's it gets more incarcerated in children. So it's important that if your child has it, you bring them to the hospital and let it be addressed early.
Okay. So Dan, I'm concerned, is this a myth as well? Most of the time people say appendicitis is when sin, you know, sits within that area. Is there a myth?
Generally it is. Generally it's appendicitis is usually an inflammatory thing, you know, when there's obstruction, and then something is blocking that place. It's a myth. So people used to say Potter used to cause appendicitis. Those kind of things, but it's generally a myth, because most of the time, you know, our appendicitis is unrelated to to those things. It related to our immune system, it related to infections, it related to parasites, related to many other things. We've not done studies to show, but it's there been no proving thing that says this is directly related.
What are partners? I guess you have some partners, like the Ministry of Health is a major partner to all of what you do, and other partners as well. What are their involvement?
Okay, so that's a great question. So let me look at the issue of partners in two forms. Number one, before I went to school, I was supported by the LCPS, the Liberia College of Physicians and Surgeons, and they supported my time to the government of Liberia and to the Ministry of Health. And they supported our time in Liberia. In Kenya, I went to school in Nairobi. So they are a major partner in terms of teaching. The other one is JFK. Apart, JFK. We have Dr. Birch, all right, a very passionate boss, who will push us to getting these things out, and Dr. Tamba was instrumental in getting us here. But those are our major partners. Now, before, and let me drive this point through, before this government, during the reign of Madam Seliv and the other administration, under 5 health and under 5 treatment was free of charge, but it was being supported by Chevron. Okay, Chevron was investing millions of dollars into that. For us, we haven't gotten that much funding. So whatever the GFK has and the Ministry of Health has and the Finance Ministry has, they have been very supportive in trying to help us get to where we want to get, and with the meager resources that we have. And so I want to reach out now to others who are listening here today, and maybe to people, to maybe your corporate social responsibility, ArcelorMittal, those organizations, or NOCAL, those people. If you're interested in helping our department or our unit as a whole, it's easy to get to us. We will share our numbers here, but the best person to get in touch with, our bosses are there. You can get in touch with me, and I'll direct you directly to Dr. Bush or to the Deputy CEO or to Dr. Tamba, who can easily tell you how you can help. You can pay for 1 surgery for a child today, 2 surgeries for a child today, and you can help a child. Yeah.
So, Dr. Benson, let's get to the services available now, especially at JFK. Yeah, what progress has been made so far in building pediatric surgical services in Liberia?
Yeah. So there's one thing that I want to talk about as we talk about progress that has been made. Apart from congenital diseases, there are diseases that are acquired. So I don't know if we know that caustic injection is an epidemic in Liberia. Because people make caustic soda, people make caustic things at their houses, children will grab that thing and drink it. It burns their throat. As a result, those children cannot feed. Almost every clinic they have come to the hospital, we will have children who have come, who have drank caustic from Bapolu, from Bommi, from Lofa, from all over, who cannot drink. All right? And a healthy child who is running up and down has been left, to die, because subsequently those children get malnourished and die. The other epidemic that we see is burns. I'm sure you're aware of the burn that happened, and unfortunately a lot of them were emitted overnight. But that is just a tip of the iceberg. What you see every day, almost, we emit a child who has been burned by hot water or by fire coal in the house. So I think it is an epidemic, and that's why I was saying it's not only infectious diseases that are killing our children, but also those diseases. And in progress that has been made is, taking us as a unit, getting us on board, because JFK didn't have a pediatric surgical unit before. So now we do have one. We've been supported by Dr. Bush. They were setting prices for these kids, for these things. And I mean, right now, hernias for children is almost negligible. Maybe when you come to do hernia for a child at JFK, the only thing you're paying for is the anesthesia, is the drugs that we're giving these children. But you're not paying for the surgical services itself, because, you know, some of the places I train, hernias will cost $400, dollars. But in our place, you're barely paying $50 for surgery, for hernia for a child, you know. And it's because we just need, because the thing is, if we operate on your child for free, we cannot help the next child. So we need to at least attach a small fee so that we can do that. But ideally, the hospital is not gaining anything from pediatric surgery, all because the administration in itself has saw it fit that we would get a child, and no child comes to JFK. She will never allow a child to come to JFK. If a child needs to be operated, she will push for that child to be operated.
Okay,
yes.
so what are the services available? So, you know, a parent listening might want to come.
Yeah.
There's a condition that maybe we did not mention. So just outline those services available now in country that JFK provides.
Yeah, so all surgical services, from urological, if you have urological issues, urological things may mean the child not peeing good, the child can pee, the child, you know, testes not coming down, you know, those kinds of things, to the surgical services, especially operating on those children. We run our clinic on Fridays, so we have a general surgical clinic for our kids on Fridays. And then apart from that, the services that are available, we also offer general pediatric services. So your child vomiting, you want to do something, they got fever, those kind of things. They all come at the hospital to be seen. And once the child comes to the hospital, we will see them in our OPD, make a diagnosis, and whatever the child needs, okay, ultrasound, x-ray, investigations, laboratory, all those services are available at JFK.
Okay, so we will just recognize our online followers, after which we open the phone line for our listeners through the radio to participate. So Melvin, you can recognize our online followers.
Yes, we have a few of them right here. And this Marian Tolawian says thanks to the great, thanks for the great job that Natolin Watch Zopu is watching, but she's her location is not mentioned. Bendu Dole is watching from Buchanan, Grand Bassa County. Frank P. Martin says I'm watching live from India. And several other persons are in the live field with comments, with likes, and you just keep following and share the live across different platforms and on the social media. Of course, is the Ministry of Health social media handle, and it's always good to follow up as we try to build our healthcare system.
Okay, so if you just join us, like Melvin say, you are listening to Roadway to Health, an hour-long program brought to you by the ministry. We are in talk this morning with Dr. Benson, who is providing details on pediatric surgical services being provided at JFK. To be a part of this conversation this morning, you can call us on 0880-514-096, 0880-514-096, or 0775-677-376. Do we have a caller? Good morning. Your name and where do you join us from?
I'm T. Alexander Tamba, calling from Doki Town.
Go ahead.
I just want to appreciate it so that at least today some of us we are educated, we get the education from him today. I thank God, even though this year I have the lessons or surgery, yeah, but we are educated for our children. Because some of those things when you tell those people, they will say that wish. You see? So I just want to appreciate him so much. Thank you.
Okay, thank you. Good morning. Good morning.
Good morning.
Go ahead, your name, where do you join us from?
This is Ezra Bobo,
Please go ahead.
Good morning, foreign. Yes. Good morning, foreign. That's all. When Nigeria message talking, they will say,
some medical conditions. Children are people who do not talk.
whenever they are suffering from development or illnesses. It makes it very difficult for the parents to detect or what of the disease.
Always people in bed. Those children need to be operated. If they need operation, I also want to advise, because especially with these people and all with that in the interior. Certain segment can be on the children. They can say they want a witchcraft. Don't say they want to the hospital. They want a dinner. Or why you was saying?
No.
Okay, okay. So that you can respond to the caller's concern.
Okay, thank you so much. Let me start from bottom to top. It's important for your 4-year-old daughter to be brought at JFK. What I'll do, my number, I don't shy away from sharing my number. If you call me, I can give you information. You call between the hours of 9 a.m. and 5 a.m. Those are the working hours from there. For those who call from Foya, Lofa County, I work in Vonjama. I work at Telewayon Hospital before. Shout out to y'all my people. I like the topography there, and and I'm looking forward to visiting one of these days. Yeah, I think those were the questions.
Yes, and it's a very good initiative. But let me go back to the live field with these concerns coming from our followers. Kalifala S. Mauro says great work there. M. Abraham F. Tamba is following the conversation from Vonjama City, Lofa County. Kalifala is concerned about the extension of this program in rural Liberia. I know you like to touch that. And Abraham Tamba is also thanking you for the kind of education you've provided so far on the radio.
And that also, there was this caller that asked as to whether his 4-year-old who has, big liver or something like that can go down for the surgery.
Yeah. I did address that. That was the first thing I addressed. Yeah, she can come to the hospital on Friday. We see her, but yes, the short answer to the question is yes.
Okay.
Yeah, so you can just address that concern from the follower online.
Yes, so that's a very good question, and that ties into one of my thoughts to have with our ministry, that we need to not only stop at ELWA Radio to educate the people, but I'm willing to go from county to county, educating people about what to do when you see these children, how to make the diagnosis, because educating our people is very important. And maybe we can go out and have some surgical camps. Surgical camp would mean go for a weekend. My cell phone number is 0772 658940. The name is Dr. Benson. 0772 658940. And you can call and you can ask me.
Morning, educating and informing you about pediatric surgical services. Augustine S. Walker Jr., Communications and Health Promotion Unit Director, and Augustine Gaima have been here taking us live on the ministry's official Facebook page. We've been your host, Angelina Noah and
Melvin Stewart.
Until next Tuesday, have a good day.